sound check. Hello. Sound check. the national anthem, please. Bismillahirrahmanirrahim. In the name of Allah, the most compassionate, the most merciful. Honorable Chief Guest, do I have your permission to commence proceedings of the event? Sir. We begin with recitation from the Holy Quran.
بسم الله الرحمن الرحيم.
الرحمن علم القرآن خلق الإنسان علمه البيان الشمس والقمر بحسبان والنجم والشجر يسجدان والسماء رفعها ووضع الميزان ألا تطغوا في الميزان وأقيموا الوزن بالقسط ولا تخسروا الميزان والأرض وضعها للأنام فيها فاكهة والنخل ذات الأكمام والحب ذو العصف والريحان فبأي آلاء ربكما تكذبان.
Jazakallah. Ladies and gentlemen, World AIDS Day is observed every year on the 1st of December to remind us of the critical need to forge a unified stand in addressing this major public health challenge. This year's theme is Let Communities Lead. This World AIDS Day is more than a celebration of the achievements of communities. It is a call to action to enable and support communities in their leadership roles. World AIDS Day 2023 highlights the full potential of community leadership to enable the end of AIDS. Ladies and gentlemen, the Common Management Unit for AIDS, TB and Malaria to manage Global Fund under the administrative control of the Ministry of National Health Services, Regulations and Coordination works as a public sector principal recipient for the three diseases. The CMU coordinates and oversees the response in the country for these three diseases, working closely with the provincial programs, the UN and development partners, alongside the communities and civil society organizations. The unit ensures resources are efficiently and transparently utilized to help those most in need. It is now my honor to invite for opening remarks Dr. Razia Kaniz Fatma, the National Coordinator for Common Management Unit for AIDS, TB and Malaria.
Thank you very much. Honorable Secretary, Ministry of National Health Services, Regulations and Coordinations, Mr. Julian Harness, UN Resident Coordinator, Ms. Kate Somwoksini, our Mission Director for the USAID Pakistan, Dr. Samuel Risk, Resident Representative, UNDP, Dr. Loai Shabane, UNFPA Representative, Dr. Inusa Kibare, Deputy Representative, UNICEF, Ms. Yuki Takimoto, our Country Director for the UNAIDS Pakistan and Afghanistan, Dr. Yusuf Filali, UNESCO Representative for the country, and Dr. Kaleem Imam, who will be joining us from the Law Enforcement Department. I also want to acknowledge the community engagement here today. So from the APL-HIV, Mr. Asghar Satti, all the UN partners, and dignitaries present here, and my dear colleagues. So today, on the behalf of Common Management Unit, I welcome you all, and we gather here to show our commitment and resolve against the HIV epidemic through innovative approaches that include promoting HIV testing, pre- and post-exposure prevention strategies, improving access towards diagnosis and treatment, and to reduce stigma and discrimination. We need to have an enabling environment to allow and empower the communities to lead in the fight against HIV/AIDS. The theme of this year, which is Let Communities Lead, underscores the crucial role that community play in our efforts to combat this global threat. Communities are the backbone of our responses to HIV/AIDS. They are at the forefront, providing support, raising awareness, and driving the change. The theme today emphasizes the need to empower and trust communities to take the lead in designing, implementing, and evaluating programs that address the unique needs of their members. As the National Coordinator of the Common Management Unit for AIDS, TB, and Malaria, I urge all stakeholders to prioritize community engagement and involvement in all aspects of HIV/AIDS prevention, treatment, and care. This means creating spaces for the meaningful participation, listening to the voices of those who are affected, and recognizing the diversity of communities in our responses. Moreover, we must continue to address the social determinants that contribute to the spread of HIV/AIDS, such as stigma, discrimination, poverty, and lack of access to education and healthcare. By addressing these root causes, we create an environment in which communities can thrive and take charge of their health. On this World AIDS Day, let us recommit ourselves to the principles of solidarity, inclusivity, and shared responsibility. By letting community lead, we not only amplify the impact of our interventions, but also pave the way for a future where HIV/AIDS is no longer a global threat. Together, we can build a world where every individual, regardless of their background or circumstances, can live a life free from HIV/AIDS stigma and discrimination. I'm very grateful to all the partners who were engaged from the last many weeks and months for this day together. And I see their tireless efforts bring us here. And not only this one, there is a series of World AIDS Day event line up after this. So I would like to especially acknowledge the motivation and dedication of community for this cause, and also to bring us to the day-to-day that we acknowledge their efforts. And in the panel discussion as well, we will discuss the way forward and visions from the national program and also the partners. So I would like to acknowledge again the participation and the commitment from the communities, and I would like to end with let community leads, and let's end stigma and discrimination. Let's end HIV together. Thank you very much.
Thank you, Dr. Razia Kanis Fatma. As aptly mentioned by you, the goals set for the National AIDS Program cannot be realized without the firm commitment of the government of Pakistan. It is now my honor to introduce Mr. Iftikhar Ali Shalwani, our Honorable Chief Guest, the Federal Secretary Health, under whose leadership HIV response in Pakistan has taken many strides forward. The Honorable Chief Guest, Federal Secretary Health, Iftikhar Ali Shalwani.
You have no. Bismillahirrahmanirrahim. A very good morning, distinguished guests, diplomats, members of armed and civil and police services, our partners from different ministries, the officials, staff from the Ministry of Health, CMU, and of course our global partners starting from UN and UNICEF, WHO, and I believe there must be from BMGF as well, and all the global partners. A very good morning, and thank you so much for being here. I have a written script. Okay, I'll come back on this, but let me just express my extreme gratitude at the outset that the way the HIV/AIDS program has been led by UN and the CMU now as Dr. Razia, she has recently taken over as the national coordinator. They have a lead, and I hope that out of the three, these diseases which we are fighting through our partners Global Fund in terms of TB, malaria, and HIV, I think HIV has always been the struggling point for us, that the progress that we have shown in TB and malaria has, the progress of HIV has not been matching up with that progress. But I hope with this new lead, and I believe this program, this day, which started, I believe, from 1988, so we are into 35th year of observing and celebrating this HIV/AIDS Day. So we have come a long way. I believe this is still a public health challenge, if not a public health threat for us, but a lot of things have to be done. And today, on behalf of the government of Pakistan, my apologies, we really wanted it to be our, and of course it is still, but still we don't, because of the COP28, the Prime Minister is traveling, our Federal Minister is traveling, a Minister of State couldn't make it, so this onerous responsibility fell on my shoulders. But still, I think we will make it a big event, and I hope nationally and globally we will be able to prove that Pakistan is doing utmost to fight this menace of HIV. So, as we said, the NC, that the theme now today, for this thing is let communities lead, and we acknowledge and celebrate the pivotal role that communities play in our fight against HIV. The world can end AIDS with communities leading the way. So that is remember and commit. So communities living with, at risk of, and affected by HIV have a greater role to play and need to join the frontline forces to halt the upward trend of HIV epidemic. On that, I would really want to say to our partners, especially UN, UNDP, who was ailing one of the PRs, when we are fighting HIV at the ground reality. Having served as a field officer in 3 provinces and now at the federal level, I would say we really need to fight HIV/AIDS like Pakistan has done a great job in COVID. We did better than many European countries. The same team, the same thing, the same administration was doing the polio, and now they are doing HIV. The same team worked wonders when we were fighting COVID. Then why can't we do the same for HIV? And what I had proposed to our partners, that we should have a frontline workers for HIV as well, like we have frontline workers for polio, like we had frontline workers for COVID. In that, I would still request, and we have already made a very formal request and a plan to UNDP that we should have in our affected, sorry, this is bothering me. I mean, like we have our frontline workers for polio, and we should have in our, yeah, that was my line of thought which I missed, that the districts that we have most affected, starting from Larkana, Kusur, Sargodha, and Lahore for that matter, and there are 10 to 15 most affected districts of Pakistan, that we should have HIV prevention units. And that we had discussed this plan about 3 months ago, and I hope it will come to fruition, and then we will be able to have our frontline workers standing in, on the ground and really confronting this task, and we have to engage the community at their doorstep. So if we sit, I always say that health is a devolved subject, we all know that. Until and unless we go to the ground, we have to go to the provincial level, we have to go to the union council level, and really knock at the doors, and then engage the community. If we expect, for that matter, sitting in Islamabad, or for that matter, sitting in provincial capitals, that we can sit and fight this menace, it will be difficult. So we have to devise a frontline force to fight this menace. Together with communities, we need to overcome funding shortages, policy and regulatory hurdles, capacity constraints, to over stigma and discrimination, and provide social protection to the marginalized communities and improve the uptake of HIV prevention and treatment services. For that, I would say again, the awareness, the people should know. I still think there was a time when I was in a very junior position as a field officer. HIV, AIDS, it was a taboo, nobody would talk about it. I would say breast cancer, nobody would talk about it. And there were other, STDs for that matter, nobody would talk about it. But now, I can say that people are talking about it. We have seminars on breast cancers. We are talking about AIDS like we are doing it now, and the communities do it. So I think Pakistan has really come forward. We are back from what we were, and I always say to our global partners, the yawning gap between the perceptions and reality about Pakistan. So I think it is narrowing down. So we are opening up, and our community leaders are proving that they can do it. An enabling environment needs to be cultivated and promoted to allow the community-based and community-led organizations to grow and act for our vulnerable populations. The community-friendly culture can add greater impetus to global and national HIV response, advancing progress towards the end of HIV/AIDS. This World AIDS Day is being commemorated to express solidarity and support to the communities and to acknowledge the role they are playing to keep the flame of selfless service to the community making alive. Empowering communities is not just a strategic imperative, it is a moral obligation. By fostering community leadership, we tap into the wellspring of creativity, localized knowledge, social cohesion that is indispensable in our battle against persistent public health challenge. So I must say that on this World AIDS Day, I call upon all our partners dedicated to HIV response to unite with the Ministry of Health for the well-being for our future generation. Let us join forces and collaborate and empower communities to lead the way. At the end, I must recognize the services and the sacrifice which our law enforcement agencies, our police service, our law enforcement agencies, they have done to fight not only HIV/AIDS, for polio, and of course we have our long list of our COVID, martyrs who laid down their lives fighting that. Really, in 2020s, when I was working as a field officer in the biggest division of Pakistan as Commissioner Karachi, I remember that we imposed a lockdown in that city, and we were successful and it was really very challenging. And this was the same community, the same health workers, the same health departments who were working. So we have to engage, and I really acknowledge the sacrifices made by our communities in that regard. I'm so grateful to the whole team which has organized. It's such an impressive thing, but I hope in the next phase we want such platforms to be held at the provincial level, at the district level, at the union council level, so that we can really make a big wave of awareness, and the people should acknowledge what they are dealing with and what the threat they are facing. Thank you once again, everyone, for being here. Assalamu alaikum.
Thank you, Honorable Secretary. Ladies and gentlemen, as mentioned by the Honorable Secretary, due to the participation of the Federal Minister for Health, Dr. Nadeem Jan, in the 28th Conference of Parties on Climate Change, he couldn't be here today, but he has recorded a message for this event.
World AIDS Day is observed. This day is observed with the motto to reflect on the progress the world has made in relationship to addressing the issue of HIV and the people living with HIV, to see what are the impediments and to propose and recommend the best way forward so we can reach everyone. In Pakistan, we have initiated a comprehensive approach towards addressing the issue of HIV. We are focusing on preventive, stigma, discrimination, and providing antiviral medication to those people living with HIV/AIDS in a dignified and accessible and affordable manner. We would like the world to know of our commitment that we would not rest until everyone with HIV is provided with the necessary medication, socio-economical support, and psychological support as well. On this day, we reiterate our commitment that no one would be left behind, and we will continue our struggle in coordination and support of all stakeholders engaged in this battle against HIV. My homage to those who are suffering from HIV and battling it with bravery. Thank you very much.
Thank you, ladies and gentlemen, for your attention. I'd now like to request Dr. Saima Paracha, she's advisor on HIV, to make a presentation on the HIV response in Pakistan initiatives and strategies.
Thank you. As we gather here today to commemorate this World AIDS Day, we're just going to have a quick overview of the HIV epidemic in the country, what we're doing to try and address this epidemic, and the future directions and challenges that we face. So what is HIV? Basically, it's just a virus that affects the immune system of the body and makes it more susceptible to other infections, so that the person is prone to getting other opportunistic infections more easily than a normal human being. AIDS is the advanced stage of the epidemic. Can we just have the first slide, please? Some of the common manifestations that we encounter, or an HIV patient tends to encounter, is prolonged fever, night sweats, persistent diarrhea, mucosal and skin manifestations, lymphadenopathy, to name a few. Can we have the next slide? This slide just quickly shows a few of the modes of transmission that are responsible for HIV infection. It can be through needle sharing, needle stick injury, where the blood of an infected individual can lead to further infection transmission, infected blood transfusions, sexual contact, during pregnancy and delivery, and even through breastfeeding. Next. So where does the epidemic put us? Globally, 39 million people are estimated to be living with HIV, of which 1.3 million become infected newly by HIV. 29.8 million people are accessing the life-saving antiretroviral therapy, with 86% of the people globally knowing their status. When we come to Pakistan, we have about an estimated 270,000 people living with HIV. 37,000 new infections are there annually. Only 41,000 people are accessing treatment, and 23% people know their status. Next, we've got one of the fastest growing epidemics in the Asia-Pacific region, with about 84% increase in the annual new infections over the last decade. We've got a concentrated epidemic, so it means we have to focus our efforts. The distribution of HIV burden is such that Punjab is the most highest burden province with 52% of infections, followed by Sindh with 37%, KP or Khyber Pakhtunkhwa with 8%, and Balochistan 3%. Next, please. Our updated AIDS strategy was designed to reduce new infections by 63% from the baseline of 2022. So how do we intend to do that? It's through focused programming, evidence-based HIV prevention programming in high-burden districts, enhancing the HIV testing and treatment coverage through a scale-up of treatment centers. We need to strengthen the HIV disease surveillance and monitoring evaluation systems for robust programming, fostering an enable environment for effective community-based and community-led programming, mass awareness, sensitization, so that we can reduce the stigma and discrimination associated with the disease. Next, please. So where do we stand in light of our epidemiology, the evidence that comes in? We've got community-based HIV prevention programming in about over 50 community-based sites, covering over 20 high-burden districts. We've got 78 HIV treatment centers spread across the country, where patients linked to treatment are being provided free of cost HIV testing and diagnostic services. Next. As a result of the efforts, this is what we've been able to achieve over the last decade. We've been able to reach 63,000 people with known status. About 41,000 of them are on treatment. Next. Globally, when we compare our progress, only 25% of the people know their status. We have a gap of 70% that we need to bridge. 17% are on treatment, and we've got a gap of 78% that we need to bridge. 7% are virally suppressed, which means that they cannot transmit infection further. So again, we have a very big gap to cover. Next. So what's the response? We have the response like we discussed with prevention and treatment programming. We designed it to complement it with other innovations and best practices like self-testing, pre- and post-exposure prophylaxis, elimination of parent-to-child transmission, opioid agonist maintenance therapy, HIV co-infection screening, and increasing community engagement, community-led monitoring, community-based programming for effective implementation and informed decision-making. Next. Some of the challenges. We've got gaps in our prevention and treatment program like we've seen. They need to be covered. We need to strengthen our data systems, public, private, all partners, so that we can truly reflect the scale of programming in the country. Like mentioned earlier by our Honorable Secretary and the National Coordinator, we need to strengthen coordination, public-private partnerships. All stakeholders need to join hands for a robust response. Mass communication, we need to raise the level of HIV literacy. The youth that we have with us today, they need to be our ambassadors for healthy and safe practices for tomorrow. Strengthening the program, we need to work together so that together we can make it Pakistan HIV-free. With this, I'd like to thank everybody. Thank you.
Thank you, Dr. Saima Paracha. Ladies and gentlemen, the HIV response in Pakistan enjoys unstinted support of the partner organizations, of which a more pronounced role is that of the UN organizations. We are pleased that today the resident coordinator of UN in Pakistan has graced this ceremony. I request Mr. Julian Harness to address the ceremony. Sir.
Federal Secretary. So sort of the people I want to shout out to in the room is obviously the Federal Secretary, the people and friends who are living with HIV/AIDS in the room today, activists, friends and colleagues from the United Nations, from the international community, government health workers, law enforcement officers. Thank you so much for being here with us today on such an important day. I'm going to build upon the excellent presentations that we've just had now and draw out some thoughts and ideas for you, particularly on Dr. Saima's presentation. So one really powerful, important message from Dr. Saima's presentation is that globally HIV/AIDS infections is reducing. We, across the world, our movement has succeeded in stopping and reducing this terrible disease. Now, what was the most, to my mind, what was the most important fact about that success across the world is that 86% of people globally know that they are living with HIV/AIDS. That is, if you know it, you can deal with it. This is disease. There is science. There are treatments. There's ways to prevent it. So if you know about it, you can deal with it. And that is why we have been so successful as a movement worldwide. However, in Pakistan, although there has been extraordinary work, and I've met some brave activists across the country, I've met doctors, nurses, I've seen the programs, people from the government, civil society, private sector, lots of people really trying hard, and we are progressing and we're having conversations about this across the country. However, there is very worrying news. The increase in new infections are increasing. Yes, we're increasing new treatments, but the new treatments are going up slower than the new infections. That is a very worrying place to be in Pakistan, and we have to change that. So what's driving that? Well, again, it was on Dr. Saima's chart. Only 23% of people in Pakistan who are living with HIV/AIDS know that they have HIV/AIDS. That means 3/4 of people living with HIV/AIDS do not know. And if they don't know, they can't do anything about it. They can't treat themselves. They can't prevent themselves from passing on HIV/AIDS to other people. That is our biggest problem. And so, why is it that people don't know? The rest of the world knows about it, but why is it's not happening here? And I think it's because we're just too shy about talking about where this is falling, right? We use other words. We talk about marginalized populations, affected communities, but we don't talk about where this is really happening. Which communities are being most affected? Well, it's men having sex with men. It's people who are injecting themselves with drugs. It is the transgender, friends and people from the transgender population. It is prostitutes. That is where the burden is falling most heavily. And we're just a little bit too shy and afraid to talk about that, and a little bit too shy to allow those communities to say their truth, their reality, and their challenges. And what's the message about for this year is about letting communities lead. So what does that mean? Letting communities lead meaning those people, those communities that are the biggest challenge, we need to make them feel safe, that they can talk about this. We need to make them feel emotionally safe. They need to have the confidence to be able to speak out and speak up on these issues. And then we, in this community that is working to stop this disease, we need to listen to them, to listen to what they need, and then together we will be able to stop the pandemic in Pakistan, but only if we give them the space to talk out, we listen to them, and then we respond to their needs. Thank you.
Thank you, Mr. Julian Harness. And as he's pointed out, today is the day to let the communities lead. Today is the day to fight stigma. Today is the day to address the issue of marginalization. And on the issue of marginalization, I would now like to invite Mr. Muhammad Usman. Mr. Muhammad Usman works with a community-based organization called the Richa Health Society, and they have done extensive work over the last 8 years, since 2015, on addressing issues related to marginalization, which increases the risk and progression of HIV/AIDS. Usman will talk about his organization and will also introduce an enactment to be performed here today by a marginalized community. Muhammad Usman.
Thank you. Thank you, ladies and gentlemen. The Richa, yes, the Richa is basically working on controlling and prevention of HIV/AIDS and STIs, specifically for the transgenders and key populations of Pakistan. About the today's enactment, yes, it's a small piece of positive response towards the stigma and discrimination which exists in the society, not only in the society, definitely in the families. So this is totally based on the struggles of a transgender individual's life. The name of enactment is From Slap to Clap, so which basically in 3 languages today, in Urdu, Punjabi, and the Farsi language. The Farsi language is the language which basically the transgender usually speaks in their circles. So it's not that much the Farsi language, I mean, easy to understand. So this is the use, the purpose of to use this language is to make just the awareness about the transgender struggles, their life, their daily routine. So I won't take much time. I will call upon my team for the enactment. Let's enjoy the play. Thank you.
खैरात दे दे, अल्लाह आपके कारोबार में बरकत करे, आपके बच्चों की खैर हो साहब।
सुना चमक चलो, तेरे बड़े प्यारे बाल हैं, क्या कर रही है?
छोटू, ये क्या तरीका है? इनसे इस तरीके से पेश हरगिज नहीं आते। ये हम लोग जैसे हैं, ये हमारे ही हैं, हमें चाहिए कि हम इनकी इज्जत करें। ये बहुत गलत बात है।
खैर हो साहब, अल्लाह आपके बच्चों की खैर हो, अल्लाह आपके रोजी रिज़्क़ में बरकत करे। खैर हो साहब, भला हो साहब, अल्लाह आपके
ठीक है,
रोज़ी रिज़्क़ में बरकत करे।
आमीन आमीन। अम्मी अम्मी, ये वसीम भाई नहीं है क्या? देखना जरा।
हाय मैं मर गई, ये तो हमारा वसीम है। वसीम के अब्बू,
ये काम भी करने लगे हो आप?
क्या हो
लोग हमें
गया?
क्या करेंगे? लोग हमें क्या कहेंगे?
बस वसीम की माँ, बहुत सह लिया मैंने। पूरे जमाने के ताने मैंने सुने, लेकिन फिर भी मैंने तुझे अपने सीने से लगा के अपने घर में रखा। मुझे नहीं पता था कि तुम ये काम भी करते हो। आज से तू हमारे लिए मर गया। खबरदार तुझे मैंने दोबारा अपने घर में देखा तो दफा हो जा। चलो वसीम की माँ।
मेरे जा 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 मेरी एक माइक लेकर आ, माइक किधर है? इधर मेरी बात सुनो, इधर आओ। वालेकुम अस्सलाम, क्या हाल चाल है?
क्या बताऊं आपको?
क्यों आज तो तुम बहुत उदास लग रही हो, खैर हो?
साहब बस इस जिंदगी से तंग आ गई हूँ। घर वालों ने जिंदगी को अजाब बना दिया और माशरे ने ठुकरा दिया। कहाँ जाऊं, क्या करूं, किससे मांगूं? रब के अलावा कोई भी नहीं है इस दुनिया में।
हुआ क्या? कल भी मैंने नोट किया आप बाजार में अजीब सा वो तमाशा एंड ऑल, क्या चल रहा था सब कुछ? तो आप माशाल्लाह इतनी पढ़ी लिखी हो, इतनी प्यारी हो, तो क्या जरूरत है अगर आप लोग के खिलाफ हैं घर वाले, तो फिर आप ये क्यों कर रही हो? आप
क्या करूं मैं, अब क्या करूं मैं? अपने आप को खत्म कर दूं? क्या कर सकती?
यहाँ पर हमारे यहाँ पर ये एक दरीचा के नाम से हेड ऑफिस है, आप वहाँ पे अप्लाई क्यों नहीं करते हो?
साहब वहाँ पे मुझे नौकरी मिलेगी?
अरे वो लोग आपके लिए तो उन्होंने इदारा खोला है।
साहब आपका भला हो, मुझे वो बता दे। मैं तो इस जिंदगी से तंग आ गई हूँ, लोगों के तानों से तंग आ गई हूँ, और मेरे तो माँ बाप ने भी मुझे छोड़ दिया। मैं कहाँ जाऊँ?
देखो पहली बात तो ये कि आप लोग आते हो, हमें दुआएं देते हो, लेकिन हमें भी तो आगे से कोई ऐसा अमल करना चाहिए कि हम दुआओं के मुस्तहिक हों। तो मैं यही चाहता हूँ कि आपका रिज़्क रोटी लगे और आप वहाँ पे अच्छे तरीके से काम करो।
अल्लाह आपका भला करे, मुझे ये बता दे, मैं सारी जिंदगी आपके बच्चों को दुआएं दूंगी।
बस आप एक काम करो, आप यहाँ से मोड़ मोड़ के बिल्कुल सामने चले जाओ, वहाँ पे वो इदारा है, आप वहाँ पे चले जाओ।
साहब भला हो, आपकी खैर हो।
शुक्रिया।
हेलो, आ जाओ बेटा। वालेकुम सलाम। बेटा कहाँ से आई हो? पहले तो कभी नहीं देखा तुझे।
गुरु मैं यहाँ पे नहीं आई हूँ, मुझे 2-3 महीने हुए हैं, और मुझे एक दुकानदार ने यहाँ पे बताया कि हमारे जैसे लोगों का यहाँ पे कोई ऑफिस है। तो ये किस चीज़ का ऑफिस है गुरु?
बिल्कुल बेटा ऑफिस है, देखो मैं अभी बैठी हुई हूँ, मैं जॉब कर रही हूँ। तो बेटा ये हम अपनी कम्युनिटी पे सेहत पे काम करते हैं ना, HIV की अवेयरनेस देते हैं, तो लोगों के टेस्ट करते हैं, अल्लाह ना करे किसी को निकल आए तो फिर उसको मेडिसिन तक लेके जाते हैं।
तो गुरु ये कैसे होता है, क्या करते हैं आप?
बेटा टेस्ट करते हैं ना। आपका पहले कभी टेस्ट हुआ है?
नहीं गुरु, मैंने तो कभी नहीं करवाया।
आपका टेस्ट पहले कभी नहीं हुआ?
नहीं गुरु।
अच्छा, आप टेस्ट करवाना चाहोगी?
जी गुरु मैं करवाऊंगी टेस्ट, क्यों नहीं करवाऊंगी।
अच्छा चलो मैं आपका टेस्ट कर लूं?
हाँ गुरु।
चलें ठीक है। अच्छा बेटा मेरी बात सुन, मेरी बात से ना परेशान नहीं होना, ठीक है?
खैर करे, क्या हो गया?
डेली क्लास में आपका टेस्ट ठीक नहीं है।
हाय अल्लाह, गुरु मैं क्या करूंगी?
कुछ नहीं बेटा, देखो बीमारी जो होती है वो अल्लाह की तरफ से होती है, इंसान को थोड़ी पता होता है कौन सी बीमारी कब और कहाँ लग जाए। तो आप परेशान ना हो, हम तुम्हारे साथ हैं, बेफिक्र हो जाओ
तो
बेटा।
गुरु मुझे कौन सी बीमारी लग गई और कैसे लग गई, ये कैसे लग गई?
बेटा ये एक वायरस है, ठीक है, जो खून के जरिए हमारे जिस्म में दाखिल होता है, और वो कोई भी जरिया हो सकता है। पान से ये बीमारी लग सकती है, ब्लड अगर आपको कभी कोई लगा हो उससे लग सकती है, अगर आप किसी HIV वाले बंदे का रेजर यूज करो, किसी सहेली का, किसी गुरु का, उससे लग सकती है। तो ये पता नहीं चलता, तो ये तो टेस्ट करवाने से पता चलता है। तो बेटा अब आपका टेस्ट किया तो आपको ये कलाम निकल आई है, तो अब इसका यही हाल है कि आप मेरे साथ दवाई के लिए राजी हो जाओ ताकि मैं सुबह आपको हॉस्पिटल ले जाऊं।
गुरु मैं अब कहाँ जाऊंगी? घर वालों ने तो पहले ही निकाल दिया, माशरा वो तो कबूल ही नहीं कर रहा, और मैं इस जिंदगी को बेहतर है कि अपने आप को ख़त्म कर लूं। मेरी तो सारी जिंदगी ख़त्म हो गई है।
नहीं बेटा ऐसी कोई बात नहीं, देखो हम तुम्हारे साथ हैं, तो ऐसा कोई नहीं है कि आप को बीमार होगे तो आप ठीक नहीं होगे। इंशाल्लाह आप बहुत जल्दी सेहतयाब होगे, इस चीज़ की टेंशन परेशानी नहीं लेनी आपने, हम आपके साथ हैं।
तो गुरु इसका इलाज है?
बिल्कुल बेटा इसका इलाज है, जो अब आपको मेडिसिन लेके देंगे वो रोज़ आपने एक गोली खानी है, ठीक है, और आप एक अच्छी और सेहतमंद जिंदगी गुजारोगे बाकी लोगों की तरह।
तो गुरु क्या इसके पैसे आप लेंगे?
नहीं बेटा पैसे नहीं, ये गवर्नमेंट ने हमारे लिए ये ऑफिस बनवाए हैं उन कम्युनिटी के लिए जो अपने इलाज नहीं करवा सकती, जो गरीब है।
गुरु मैं जरूर करवाऊंगी।
बस ठीक है बेटा, फिर मैं सुबह आपको लेके जाऊंगी, बस परेशान नहीं होना, ठीक है, हम तुम्हारे साथ हैं।
जी गुरु।
ठीक है बेटा, अब परेशान ना हो, मैं तुझे ना अभी खुश करवाती हूँ थोड़ा जा एटम साउंड दिखा के, ठीक है? अंबर बेटा बच्ची आई है, थोड़ी सी परेशान है, इसको खुश करो।
चाटी च फेर मदानी रे कुट कुट वे कुट कुट पी जानी, हाय वे कुट कुट पी जानी।
एक माइक तुम लोग लेकर आओ ना, इन लोग को हमारे पास है। जो आई में चेंज
कर लो, चलो उस टेलर के पास।
मैं कह रही थी मैं देख लेती एक दो सूट और।
चलें बस बहुत है ना, टेलर से बात कर लो।
वालेकुम अस्सलाम, क्या हाल चाल है? जी अल्हम्दुलिल्लाह सब ठीक ठाक जी।
मेरे कपड़े रेडी बेटा?
हाँ जी आप लोग बैठिए, छोटू इनको पानी ला के दो।
नहीं बेटा बस आप मेरे कपड़े मंगवा दें, हम लोग थोड़ी सी जल्दी में हैं।
चले कपड़े भी आ जाएंगे। सुनाए वसीम का क्या हाल है? वसीम ठीक है?
हाँ जी ठीक है, बस
क्या हो गया? अब तो मेरे ख्याल से आप लोग को उसके साथ थोड़ा सा ठीक होना चाहिए था, वो तो माशाल्लाह ठीक।
ऐसा क्या कारनामा अंजाम दे दिया जो मैं उनके बाप को कुछ कह सकूं यार?
नहीं उस दिन जो बहुत सारा परेशान था वसीम, मेरे पास आया, उसको मैंने मशवरा दिया कि वो एक इदारे में काम करे, और वो माशाल्लाह वो तो बहुत अच्छा कमा रहे हैं अब।
कहाँ पे?
वो तो यहाँ पे दरीचा में, उसको मैंने यहाँ पे नजदीक एक ऑफिस है, तो मैंने वहाँ का उनका पता बताया था, वो तो माशाल्लाह 2 महीने से वहाँ पे है।
तो बेटा आप मुझे उनके एड्रेस बता सकते हैं, मैं वहाँ जाके
हाँ जी क्यों नहीं छोटू, यार इनको लेके जाओ उधर ऑफिस में।
हाँ जी बेटा।
ये कहाँ तो मुझे ले आई हो, यहाँ पे तो मुझे लगता है सब ख्वाजा सराई होते हैं।
मिनट आप देखे तो सही, मैं आई हूँ तो कुछ तो देखते तो हैं क्या है क्या नहीं, देखे तो सही।
चलो चलते हैं।
वालेकुम सलाम, कैसे हैं आप? कैसे आना भाई, बैठे जी, क्या खिदमत कर सकती हूँ आपकी?
बेटा मैं वसीम की अम्मी और इनके अब्बू हैं, हमें उस टेलर ने बताया कि वो यहाँ पे जॉब करते हैं।
कौन वसीम?
वसीम आई थिंक सब उन्होंने अपना नाम क्या
मैं
बताया।
बताता हूँ तुम्हें वसीम, वो जो यहाँ पे गलियों में भीख मांगता फिरता है, वो मेरा ही बेटा है।
अच्छा, वो जो अभी जिसने जॉब की है हमारे पास,
हमें बताया है किसी ने कि वो यहाँ पे जॉब कर रहे हैं।
आप उसको वसीम के नाम से जानते होंगे। जहाँ वो हमारे पास है तो हम अपने कम्युनिटी के नाम से जानते हैं। आप शीला की बात कर रहे होंगे।
देख रही हो तुम, हर जगह ये मेरा नाक ही कटवाता है। बुलाओ जरा उसे, मैं देखूं।
नहीं, आप इतने खफा क्यों रहते हैं?
उसने सारे माशरे में मेरा नाक कटवा के रखा हुआ है। कोई उसने जिंदगी में ऐसा काम नहीं किया कि जिस पे मैं सर उठा के फख्र से महसूस करूं।
क्यों?
बस उसको बुलाओ यहाँ।
वो यहाँ पे जॉब कर रहा है, हजारों लोगों की जिंदगी के सेहत पे काम कर रहा है, क्यों शर्मिंदा है आप उनसे?
बुलाएं आप उसे।
आप गुस्से को तो जाने दें।
शीला, बच्चे बात सुनो।
तुम यहाँ पे जरा बैठो, तुम, मैं देखने आया तुम क्या जॉब करते हो।
बैठो बेटा। कुछ नहीं कहेंगे, मैं हूं ना, कुछ नहीं कहेंगे।
ये क्या जॉब करते हैं आपके पास?
आपको पता है ये ऑफिस है एक, ये हमारी कम्युनिटी का ऑफिस है और हम अपनी कम्युनिटी के सेहत के हवाले से यहाँ काम कर रहे हैं। यहाँ पे कोई ऐसा गलत काम नहीं होता जिसकी वजह से आपको अपने बेटे की वजह से शर्मिंदगी उठानी पड़े।
अब्बा, आप तो कहते थे कि मैं आपका नकारा पीस हूँ, मैं आपका नकारा बच्चा हूँ, लेकिन देख लें आज वो नकारा बच्चा कितने लोगों की आवाज़ बना हुआ है। मैं अपनी उस कम्युनिटी को जिसको ये माशरा तस्लीम नहीं करता, मैं उसके लिए एक मिसाल बनना चाहती हूँ और बन रही हूँ। मैं अपने जैसे बहुत से लोगों को एक खूबसूरत और सेहतमंद ज़िंदगी दे रही हूँ। मैं उनको उनकी सेहत के बारे में बता रही हूँ। आप ही थे जिन्होंने मुझे शुरू से ही इस माशरे, इस जालिम माशरे के हवाले किया, लेकिन मेरे अपनों ने ही मुझे अपनाया। यही कम्युनिटी मेरी अपनी है जिसने मुझे प्यार, इज्जत और आज एक मकाम दिया कि मैं आज आपके सामने और इतने हजार लोगों के सामने अपने आप पे प्राउड फील करती हूँ कि मैंने अपनी ज़िंदगी ख़राब नहीं की। मेरी ज़िंदगी को बनाने में मेरे दरीचा ऑफिस का बहुत काम है, बहुत नाम है।
देखें, आप कहते थे हम लोगों ने एक ऐसे बेटे को जन्म दिया है जो कि हज़ारों ज़िंदगियों को बचाता है। अब भी अगर आप इसे कबूल नहीं करेंगे तो ये हम में सारा ऐब आएगा और सब हम लोग देखेंगे। आप अपने बेटे को
हाथ भी उठाना उसको।
सारे आ जाओ। वो बाद में
Thank you, ladies and gentlemen, for your attention. A very moving performance from a marginalized segment of society. Today, in consonance with the theme of World AIDS Day 2023, it is important to recognize the role of communities. But where it is important to recognize the role of communities, it is also critical to pay tribute to those who have partnered in the cause of HIV prevention and response in Pakistan. And I believe the best way to pay tributes is to listen to the partners. And to listen to the partners, we have organized a panel discussion. I would like to call upon the panelists to come on stage and take their seat. Dr. Razia Fatma, the National Coordinator, Mr. Julian Harness, the Resident Coordinator, if he hasn't left, Ms. Kate Sovongsri, the Mission Director, USAID, Dr. Samuel Risk, the Resident Rep of UNDP in Pakistan, Dr. Louis Shabane, the UNFPA Rep in Pakistan, Dr. Yusuf Filali McNassi, the Director and Rep to Pakistan of UNESCO, Mr. Asghar Sakti, the National Coordinator, APLHIV, and Dr. Syed Kareem Imam. If you can please join us on the stage. I would request the UNAIDS Country Director, Yuki Takemoto, to moderate the... if Mr. Inusa from UNICEF can also join us on the stage to be part of the panel discussion. Mr. Inusa, the Deputy Rep. I request Yuki Takemoto. I have learned over years to pronounce her name properly. Yuki Takemoto to moderate this discussion. And Yuki has instructed me to intervene if the submission of any of the participants goes beyond 10 minutes. Thank you.
Thank you. Thank you. Thank you very much for the introduction. I have the pleasure to introduce the distinguished panel that represents key sectors and partners that are leading and contributing to the HIV response in Pakistan. And I'm going to keep my introduction short, and in order to allow the maximum time we can to each person to share their views. I would like to start with Dr. Razia, the National Coordinator of CMU. If you could please share your vision on what is needed to end AIDS in Pakistan.
Thank you very much, Yuki. I hope I'm audible to everyone. So I would start from the commitment which our Honorable Secretary Saab have already made, that we have to have some innovative approaches. Over the past many years, we have done a lot. Of course, in the Common Management Unit, we have done a lot for tuberculosis. But when I see HIV/AIDS statistics, it really worries me. So we have to have a very robust and such a roadmap for the country that we close the gap. We need to improve the statistics when we look at this 95 targets. So what we do out of box to do better in the next few months and in the next years. So first of all, we have a roadmap with us in the form of prevention and the global strategies from the globe. So we have to really look at all these documents that are already guiding us how to move further, what world is doing and what we are not doing. So we really have to have analysis of where we stand in terms of data. So the moment I have joined, I had a meeting with the HIV colleagues, and I see that there is a need to do an in-depth data analysis to see high burden districts, to engage academia and the research partners with us to guide us better where to go. I think we have a huge capacity need as well in the community and within our centers. We need to see how to go beyond what we have done already. So I really look forward that in the next few months, we've jot down a plan to engage, of course, the community, the academia and research sector as well. To have an in-depth analysis, we would look at the high burden district where we have to focus. As Secretary Saab has already mentioned, we need to establish prevention units. We need to start with innovative approaches to increase access towards communities. So I see that self-testing is recently introduced by WHO in Larkana Ratadoiro. So we really need to have a detailed, in-depth analysis of how it is helpful to go beyond what we are doing now. And then in terms of surveillance and data captures, I think there are a lot that we need to be done. So we have to have a complete roadmap, and this is my first instruction to all my colleagues, and inshallah we'll be following this meticulously, that we have a robust surveillance and M&E systems, because I do see that, as Secretary Saab has already said, that we have done a lot, but from the national level, we need to go to the communities at the district level. We need to engage the provincial departments as well, but we have to have a robust M&E surveillance plan with us available to go to the community where we have not touched so far. We need to have prevention strategies, testing strategies. We need to think about how to engage the communities through mass awareness. And of course, we need to have we need to see how world has done innovative approaches. So I would really focus on, as I said, testing services, pre and post exposure prophylaxis, OMT, which is our part of the agenda, which is part of our strategies. But we need to look at how to go beyond what we are right now. So let's think about the HIV co-infections. Let's think about, so I would not forget, of course, tuberculosis, because TB is also, those who are affected by HIV, they are more prone to have this TB infection and all other co-infections with HIV. And of course, we will strive towards increasing community engagement, and we will have a complete plan of action with us, which will be shared with the union partners and with the multiple stakeholder participation and discussions. We will go ahead. And of course, we are open for any suggestions from the UN partners. Again, I want to thank all the partners here who have helped us to prepare this response. And of course, in the coming months, we will have this complete plan of action with us, so that we follow with the targets and we achieve results, and when we deliver and we change the statistics that is being showed for last many years, inshallah. Thank you very much.
Thank you so much, Dr. Razia. I would now like to turn to Mr. Oscar Sati, who represents community on this panel. And the Association of People Living with HIV has embodied community leadership since 2008. And of course, the theme this year is Let Communities Lead. Can you please reflect on the theme and what key messages you have for partners on the panel but in the room?
Thank you. First of all, I would like to take the opportunity to thank Common Management Unit, Ministry of National Health Services, UNAIDS and other partners for providing me with the opportunity to represent the community of people living with HIV here at this very important forum and important day. I think the theme of this World AIDS Day is very interesting. Interesting in a way that, it highlights and recognizes the role of communities that they have played around the globe in the HIV response. And I think the importance of this theme is that you yourself, you are moderating the session. So I think this reflects the importance of this, theme. For me, community leadership basically is the fact that the communities should be placed at the center of HIV response at every stage. And this is not something that is new. This is not something that is unknown. Several international documents, agreements, instruments, they recognize the need and importance of placing the communities at the central place in HIV response. Why? Because the community leadership is the trust of the voices of communities. Because the community leadership, they understand that what are the needs of the communities at grassroots level, what is working well and what needs to be changed. And then again, the community leadership has played a very pivotal role, a very critical role in moving forward the HIV response, not only in some specific countries and regions, but across the globe. The community leadership aims and focuses that the voices of the communities are raised at the appropriate platforms, and voices are listened to as well by the policy and decision makers. And it is the basically community leadership that promotes the leadership of the communities as a full, reliable, and essential partner of HIV response. I think this is the community leadership in case of Pakistan that has taken the HIV from the closed room to the public places. And this, I think this journey is something that is really very interesting and an example as well. There was a time, couple of years back, once it was considered to be very unsafe to talk of HIV outside the rooms. But today we are talking about the HIV on the loudspeaker, on the sound system, at the public places like Lokwirsa and in the cricket ground. So that's what the community leadership is, and that's how we say that the communities make the difference. And I think this is the first step towards the major achievements. If we talk of the leadership of people living with HIV, so I think we have a uniqueness, and that uniqueness is that we are having the lived experiences of Earth, and we speak, we raise the voice, and these voices and these experiences, they basically need to remain at the critical position. They need to remain at the central position. I think many representatives from the diplomat community are sitting here. High-ranking government official, Honorable Secretary Saab is sitting here. I think one of the major challenges that the communities are facing, and in countries like Pakistan, HIV response is facing, that is, a very sudden and I would say that notable and remarkable backslide in the resources that we have, And this shortage of resources has not affected the HIV response, but also the communities and the community leadership. So taking the opportunity of presence of high government officials and the diplomat community here, I would kindly suggest that we know that there is a shortage of funds to the global fund as well in their current replenishment. So I think in low-income countries and middle-low-income countries, global fund is the main driver of HIV response. So I think they need to be fully funded so that in response, the communities and the HIV response at the country is fully funded. Coming on to the key messages, one strong key message from my side is, and this is based on my experience as a person living with HIV, and that is that HIV is defeatable. HIV is beatable, but the way the path goes through the communities. You have to place the communities at the forefronts and in the center of the HIV response, and you have to fully fund them. Thank you.
Thank you so much, Askar, for your powerful message. I would now like to turn to Kate, who is the Mission Director of USAID in Pakistan, who is representing the donor community, in a sense, on the panel. But also you bring extensive experience in development and HIV from other PEPFAR countries. What are the key lessons that could inform the HIV response in Pakistan? We've seen the presentation. If you could share your reflections.
Thank you. Is this on? Yes. Thank you, Yuki, for the question. It's really an honor for me to be here with all of you today, and especially to hear from and learn from the community members. So thank you so much for the powerful and moving presentation. So today, as we sit here together and commemorate 35 years, 35th year World AIDS Day, we're also marking the 20th anniversary of the President's Emergency Plan for AIDS Relief, PEPFAR, as Yuki noted. The accomplishments under that program over the 2 decades have been astounding. 5.5 million babies born AIDS-free and 25 million lives saved. But as we know from today's presentation and collectively, there's so much work left to be done around the world and here in Pakistan. Right now, around the world, there are 1.5 million children living with HIV, and only a little over half of them are actually getting the treatment that they need. So I'm happy to share a few lessons from other PEPFAR countries. I know Pakistan is not one, but there are also some limitations to sharing those lessons, and I would just acknowledge that at the outset. While the rates of HIV rates here are concerning and rising, which is a trend different from the rest of the world, it's still a very concentrated epidemic with a less than 0.1% prevalence rate. Whereas in the countries around the world where PEPFAR works, mostly in sub-Saharan Africa, the rates are much, much higher. If I'm not mistaken, in sub-Saharan Africa, the average is over 9%. In the country where I've come from most recently, Tanzania, it's 4.5%. So it's a generalized epidemic. It makes for very different in terms of amount of resources that are available, the infrastructure, and the approaches. That having been said, I'll share 4. Don't presume to say they're lessons. I've only been in Pakistan for 3 months, so I can't presume to know what works here. But 4 observations of what I've seen work that I hope will resonate here. And the first one we've been talking about all day already, and everyone here is aware of, is the role of civil society organizations and communities, the essential role that they play. In Tanzania, where I came from most recently, civil society and communities, including religious communities, had a huge role raising awareness, advocacy, which I know happens here, but also direct delivery of HIV services, and a really strong voice in the policy debate, especially around some really difficult issues around stigmatization and key and vulnerable populations. That will be key in Pakistan. I know it's very different. In PEPFAR countries, we had 20 years of investment in CSOs and in communities directly. So having those resources here, we've already seen, from this morning alone, how the role of community members can really help the most stigmatized members of society, men who have sex with men, transgendered people, sex workers. So I think that will need to be continue and ramped up here. The second, in terms of approaches that work, are really integrated approaches. Systems where you're working across the entire health system, strengthening the system more broadly so it's holistic and resilient, as well as integrating data systems overall. And beyond health, from a broader development perspective, where we're working across the board on economic growth opportunities, on youth and engagement, on women's empowerment program, having a holistic approach overall. The third of the 4 lessons I'll share is the role of government. In many PEPFAR countries, government has a whole of government approach. It's a very elevated role, often Prime Minister's office or in the Ministry of Health, but it's multi-sector coordination with an elevated role that is able to harness and tackle all of these different integrated aspects. I know in Pakistan it's quite obviously a different political system, a very decentralized one, which adds another layer of complexity. And then the 4th and final lesson I'll share, which everyone in this room knows well already, is the importance of partnership. No government anywhere around the world has ended this alone in their countries. It will not happen here, it will not happen anywhere else. We need communities, we need CSOs, we need private sector, we need international partners like all of us who are here. So that's why the United States is so proud to have always been and remain the largest donor to the Global Fund, which is contributing to 1/3 of its overall funding. We don't have a bilateral HIV/AIDS program here with USAID, but we do have a substantial tuberculosis program. And as Dr. Razia noted, tuberculosis is the leading killer of people with HIV/AIDS. So we're proud to partner with you all. We're committed to this partnership, and we believe that together we can end this public health threat here in Pakistan and around the world. Thank you.
Thank you very much, Kate. And I think that's the perfect transition, as you mentioned, the role of the Global Fund, for me to turn to Sam, who is the UNDP resident representative. And of course, UNDP is leading the implementation of the Global Fund HIV grant as the principal recipient since July 2021. So I would like to ask Sam if you could please share the progress made, challenges that remain, and how partners here can help support, complement UNDP's efforts.
Thank you very much. Yuki, it's a pleasure to be here among a lot of partners and donors to speak after Kate, with the U.S. being the greatest supporter to the Global Fund. It's a pleasure to partner with the government, Secretary Shalwani, and everyone here. I have a long list of people that I can thank, but I think everyone here has been really appreciated for the kind of investment of time and commitment and dedication into a cause that I think, as mentioned, is still for some people an issue of stigma. Now I think a lot of this is out in the open. Most importantly, I think the partnership with government, civil society, the UN system, and many of the communities around is what really matters. So to respond specifically to the question, in this particular grant since 2021, there are achievements and there is forward progress, and I'll mention a few of those and then maybe come back in the same spirit as was mentioned earlier on things to do better. Now, not necessarily challenges, but how to improve. On prevention and treatment, there is a large expansion. The number of treatment centers run by government have gone up from 50 to 78 over the last year. And this is a huge opportunity to congratulate the government, the ministry, federal, provincial, on how much work they are doing along this. But, as the previous presentation indicated, receiving treatment, 40,000 people, we still have a long way to go, whether you count another 150, 60, or even 200,000 people still to go. Secondly, prevention services have also seen a large expansion. In 1 year, service sites increased from 19 to 53 across all provinces. And this is critical for all of the populations that require this kind of support, but it is critical for KP and Balochistan particularly because this is the first time that these centers have actually appeared in these two provinces. This particular year, we're celebrating the work of the community-led, and there are more than 400 outreach workers now working among key populations to support and train around quality and relevant prevention services. We report regularly to the Global Fund. This is the indicator that has gone up the most. So this is a 100% success, so well above the expectation as well. There are a number of firsts that I think are important to mention here in Pakistan over the past couple of years in the duration of the grant. Access to justice services to key populations. We have lawyers and counselors working on psychosocial support. I think what is most striking and provocative about the skit that we just watched now is how short the distance is between verbal violence and physical violence. And if protection is an issue, law enforcement, justice, lawyers, counselors really need to be part of this particular response. Secondly, community-led monitoring, which is, I think, part of the theme here. If there is this mutual accountability between a service provider and a recipient and a watchdog community in the community to say, this is what works, this doesn't work, this is what we need you to focus on, then I think this is one critical first that we've actually seen so far. Now, a couple of things that I think are important, maybe in the spirit of lessons or what comes next as well, or what to improve. If we are driving a car together, and I think Secretary Shalwani mentioned this is not the time to take your foot off the gas, because any complacency has significant regression consequences in numbers, in access, in quality, and because there is a real threat in particular areas that the numbers will go back up. And that's why part of the work that we do is to be able to support decision makers in all levels with evidence, with the kind of evidence base that requires them to make rapid decisions. This includes certainly the Ministry of National Health Regulation and Coordination, provincial AIDS control programs, the Drug Regulatory Approval Program, and of course the Association of People Living with HIV AIDS. Now, a few very quick things to point out. One is on human resources. I visited a treatment center in Quetta last week, and the doctors there have the kind of commitment and dedication that is required, but the second level, third level, fourth level leadership is very thin. The roster is very thin. If these particularly committed doctors move on, move away, become engaged, where is the second level, third level medical health capacity to be able to actually take this up? We have retirees that are working in these centers because they are dedicated, they are compassionate. I think this is a capacity issue, it's a leadership issue, it's an education issue, and it's an incentivizing issue for everyone that really wants to be part of this response. Everybody speaks about coordination between federal and provincial level health services. Yes, more of that is required. Anything we can do to help, I think, is more important. A third challenge is, I think there is a focus, perhaps an over-focus, on treatment centers and maybe prevention facilities that are in the capital. There are people in Balochistan who will go very, very long distances avoiding or bypassing the center that is closest to them, but they want to be in the capital because they know that that's where they can get the best service. In many cases, best service, good service, adequate service is just as close. I really think this is an information problem, this is an awareness problem, rather than actually a service problem as well. Maybe just to close, at UNDP, I think we are really, really proud to stand with the leadership of the government and with the leadership of the community moving ahead. The level of stigma, discrimination that I see here in Pakistan is being overcome gradually is really quite important, and you can count on our support for as long as is needed to be able to not only address the problem as it currently stands on AIDS and HIV, but to really see the end of HIV and AIDS in Pakistan. Thank you.
Thank you so much, Sam. And we do have several key UN partners on the panel, and I would like to turn to Luai as the UNFPA representative. And UNFPA is the co-convener of the Global HIV Prevention Coalition that includes Pakistan. And these are 25 countries with the highest HIV burden, but also with the highest increasing new infections of HIV. Now, Luai, how can we expand HIV prevention, especially among young people in Pakistan?
Thank you very much. Let us agree on a principle. In Pakistan, if there is a will, there is a way. Nothing could not be implemented fully in this country. HIV is a genetic ingredient of UNFPA's mandate as the agency responsible for sexual and reproductive health. But let's agree that this pandemic is of health, social, and political significance. And there is a very important role for politicians in finishing this. Because if politicians normalize the speak up about it, all doors will be open. This is a principle. Because if I compare Pakistan with other countries in the region, just in the last Asia-Pacific Regional Conference on Population and Development, the statement of Pakistan was the most powerful. Thanks, my brother Iftikhar and for the Minister of Planning, Minister of Health for doing a great job. And the delegation of Pakistan was the best coherent civil society and government. They really did a very good job. And the statement of Pakistan was the most progressive when it comes to transgender, to HIV, to reproductive rights, and other issues. Therefore, let's agree on this, because this is very important to put it in the context. Definitely, services are very important. Awareness is very important. But changing the social norm is a key. And to do this, we have to unpack what is religious from what is conservative. Because today they are mixed together. Nobody can touch. Unless we unpack, decompose the domestic culture from what is religious, what is haram and halal, and what is inherited from the culture, because what inherited could be changed. We cannot change a religion, and nobody has the intention to change the religion. But we can change what inherited from the culture to open up spaces for people to speak up and to normalize speaking about this pandemic, about this disease, about virus that could be handled. And this unpacking, in my opinion, is very important. It's time to do that. Now, young people are the most affected by this and the most contributors to this. Therefore, denying that there is sexual activity before marriage will not solve the problem. And speaking about it is not encouraging it. If we don't reach this point, we will not be able to open all these black boxes and these ghettos. We have to agree that this is in Pakistan and everywhere else. There is sexual activity. And speaking about it and raising awareness among young people about how to prevent themselves and how to treat themselves, where to go in order to get treatment if they got infected. Without speaking about this, we will not be able to solve these problems. Project after project after project will not solve it. In my opinion, the leadership of the government at the federal and provincial level in leading this sort of talks and debate is important. I'll stop here. Thank you very much.
Thank you so much, Loai. And you touched on young people and the importance of education. So I think I will turn to Yusuf, the UNESCO representative and director. UNESCO is a specialized agency on education and leads the Global Education 2030 agenda through SDG 4 in particular. What is the role of education in the HIV response in Pakistan, Yusuf?
Thank you. So I think Sam, mentioned it, during at the end of his, this talk, and my colleague, did the same thing. Sam said that, it's an issue. Education is an issue. I would call it, an opportunity and a solution, as it was mentioned. We believe that education is a foundation in Pakistan's, effort to combat HIV/AIDS. It's not just, a part of it. It's a foundation, to get that. Serving as a vital tool to raise awareness, prevent new infections, empower key populations, young included, and foster supportive environment. We need an environment where we can discuss, as it was mentioned. Education also, helps to address some of the main risk factors. If young, they don't know, about it, they cannot preserve themselves from it. So it's very important, and we have, to work through it, through literacy. Also, on the poor economic status of, the social, taboos, stigma, and discrimination, because there is discrimination. But first of all, education serves as a means to disseminate essential information to young, and not only young, also vulnerable individuals on how IHV spreads and how they can protect themselves from getting infected. And the solution is, there. We have to empower individuals with knowledge about safe practices. The education system aids is reducing the stigma and discrimination associated with the virus. We believe that through targeted education initiatives addressing the challenges faced by groups of such as sex workers, and I think RC mentioned it earlier, transgender persons, people who inject drugs, and men who have sex with men, social and economic vulnerability are mitigated. So we need also to work on that. This empowerment extends beyond health knowledge. It's not only about health, offering diverse income generation, prospect, and enhance access to resources. These people need to have a job, so they can be away and go from those networks where they are being abused and used. So in our case, UNESCO, we had this opportunity with the South Punjab education department, where we were supporting 2 of the schools for now more than a year on transgender, and working with them on bringing skills through different labs, IT labs, beauty parlors labs, stitching labs, to empower them, give them independence, and make them having skills and generate money for themselves, so they can be out of that environment and get confident on their power, and have some independence and get like I said, confident. So that's one of the examples that we had, and we were working on it for the last 18 months, and we are proud of it by supporting them, but also because they are willing to do it. It's not only about us, it's also about their willingness on getting out from that environment. And thank you very much.
Thank you so much, Yusuf. And we have touched on young people, and I think I would like to turn to Inusa, the UNICEF Deputy Representative, with the mandate, of course, of children. And UNICEF has been leading critical areas of the HIV response for many years in Pakistan. Could you share insights from the key programmatic areas and highlight challenges, but also maybe progress?
Okay. Thank you very much, and Assalamu alaikum, and good morning to everybody. I'm really very delighted to be here and to celebrate the World AIDS Day with all the partners sitting here and with the government. UNICEF mandate, as you know, it's children, and UNICEF Pakistan has really been leading and supporting the reduction of vertical transmission from the parents, and improving the detection, not only the detection, but also the management, including the care and treatment aspect. The second aspect that I want to mention is that we have also supported the proposal for the Global Fund, and we have been able to integrate the PPTC, pediatric HIV infection prevention control and outbreak response into the proposal, which is really very, very important. The third element that I would like to mention is that we have been sustaining our support to PPTCT and pediatric ART in Ratodero and CMC Children Hospital specifically in Larkana. And this is since the outbreak in 2019. And we have been working with all the partners to continue to support. Our support is also the access aspect that was presented here to support the government and all the partners to establish additional treatment sites. And one important element that I would like to mention is related to the theme today, let the community lead. We are working on the community mobilization aspect, and it is all society approach that we have taken to sensitize and to bring about strategic behavior change related to HIV AIDS prevention, related to the stigma and discrimination. And when I say all society community based influential approach, it's sensitization of the religious leaders, the teachers, the healthcare workers, and also including the media, the journalists, and all the other partners and CSOs at the community level. Evidence generation is very important, and we have also worked with our partners to do a retrospective analysis with Aga Khan University to assess the effectiveness of the interventions that were taking place as a support to what was happening in Larkana. And currently we are using these findings to fine-tune the interventions together with our partners. Just to give some few findings, out of 1,800 children diagnosed with HIV, 70% of them are in the Rotadero Center, which is an area that need a focus. And what is really very critical for us to understand is that even now, an average 15 new children register each month. So it means that the prevalence is increasing, and we have to really pay attention to this area. So our effort need to really continue to assist these children and their families. We have also convened a national consultation with the government and the partners to try to work and come up with a roadmap that Madam was kind of raising here. Obviously, there are some challenges, and allow me to mention maybe a couple of challenges. The access. I think the access, we need to really continue to pay attention to the access. Madam presented that there are 78 centers that exist. But when we look at it for children perspective, which is really a preventive measure, it's only 17 that are PPTCT sites. So we have to work to try to increase the number of centers. The second challenge that I would like to mention is the prevention at the facility level. For example, the study that we have done, it has demonstrated that 25% of the women who are HIV positive have had their spouse who are also HIV positive. It appears that most of the infections happen at facility level through the injections that are being provided as part of the antenatal care. So infection prevention is going to be very important. The last element I would like to mention is related to the treatment aspect. Most of the time, the children who are coming at the hospital, they come at the last stage where they are malnourished and sometimes with TBs and other pulmonary infections, which led to their issues and loss of life. So I think we need to continue to engage the community to address the stigma and discrimination aspect, and let the community lead as is the theme for this year. Let me conclude by saying that together with the government and all the partners, we can bring about a free vertical transmission in Pakistan. Thank you very much.
Thank you so much, Inusa. And last but not least, Dr. Kaleem Imam, who sits on this panel as a law enforcement specialist. Of course, you are an expert in this area of law enforcement and governance, and you have been also the Inspector General and the Federal Secretary. And I think you were instrumental in bringing some of the partners from law enforcement agencies to be present for this World AIDS Day commemoration. So thank you for that also. You also helped draft the strategy recently to engage law enforcement agencies in the HIV response in Pakistan. Why is it important to engage law enforcement agencies?
Yuki, thank you very much. Respected panelists, ladies and gentlemen, and my ace tennis star, Ms. Iftikhar Shalwani, who avoids playing tennis with me every day. Good afternoon and Assalamu alaikum. I see some young students sitting over there. It was in '86 when I was preparing for my civil services exam that I was going through some tutoring sessions where one of the speaker who came and said, "We are so fond of asking for AIDS. Don't ask for AIDS. Look what it did to Rock Hudson." So that is the first time I heard about the disease, and this is what it can do. And secondly, it would be surprising at what a law enforcer is doing over here. Well, I also teach human rights law, and a lot of people make fun of me that a police officer is teaching human rights to the faculties. Coming back to our topic, I would like to say on the onset, I have words to appreciate and words to thank the team, especially I would mention over here the UNDP and some of the professional officers they had over there, like we see Dr. Nashmia, Sumaya, and Dr. Haither, and who can forget Yuki, your team, the wonderful Mr. Rajwal over here, and Femida. I think we must give them a big hand for doing such a wonderful job for our country over here. So I have an engagement strategy over here, and I'm proud that I was able to do it. And it's an inclusive document, consensual document. It has been prepared after a lot of multi-stakeholders conference that we did all over Pakistan. We took the inputs from the health, from the law enforcement, the inspector generals, the chief secretaries, the health departments, and it went so well that at the end we came up with this document, which is around 60 pages document. And I would just very quickly run through and let you know what we have done in it. Primarily, there's some wonderful work which is being done by the Health Ministry and the other departments, but we came up with a lot of recommendations, which were like short-term recommendations and medium terms and long terms. Police in Pakistan has something has a very important role to play. Even the topic that you see for today is let communities lead. So when we talk about that, it's like, let's have a community policing. Let's involve the law enforcer. Why should we enforce the law enforcer? That was the question. Well, they are the first person to be on the site. When you go to highways, motorways, you can come across people who undergo through accidents. And what about if the law enforcers come to know that they are having HIV? How would they respond? We also come through a lot of process in the investigation, like in the interviewing witnesses, complainants, and even in criminal cases. So it is so important that the law enforcers should know what is it all about. So we have recommendations over here where we suggest that they need to be engaged and empowered. We need to seek their support to effectively enforce laws and regulations. We need to involve them to ensure effective implementation. And in the medial term, we stand for partnerships. We believe that partnership will play a very important role, develop protocols and guidelines, conduct awareness campaigns, enhance the capacity, advocate for policies through law enforcement agencies. There are 15 police organizations in Pakistan, beside the other civil armed forces. And there are around more than 0.5 million police officers right now on the street performing duty to prevent, detect, and prosecute criminals. These are the people who are first to reach on the site. They didn't know about HIV so much. But once UNDP came up with this project and UNAIDS started all this process, it is an interesting outcome that many inspector generals have carried out HIV tests, and it is sad that we found few cases over there. Without disclosing, they have started their treatment, and it has been a very helpful exercise. I believe this strategy, as we move forward with curriculum and SOPs and guidelines, the law enforcers will be rightly equipped as they come across people suffering from this ailment. जो मेरे बच्चे और दोस्त पीछे बैठे हैं, मेरे लिए आपके लिए पैगाम है कि HIV एक सिर्फ बीमारी है, ऐसी जैसे आपको शुगर की बीमारी हो सकती है, ब्लड प्रेशर की बीमारी हो सकती है, एक बीमारी है. अगर ये एक तो इससे एहतियात करें, लेकिन अगर खुदा न खास्ता हो जाए तो बहुत से ऐसी तरकीबें हैं जिससे आप जो है बड़ी लंबी उम्र जी सकते हैं और दूसरों को भी उससे बचा सकते हैं. Like stay away from the drugs, syringes, safer sex practices, and at the same time, when we talk about the blood transfusion, I think we would be needing certain resources for the purpose. But again, this strategy is going to go a long way, and I think UNDP and UNAIDS deserve a credit for that. It wasn't there before, and when we went to the field and Famida and Rajwals were with us, Yuki headed some of those multi-stakeholders conference, all the law enforcers were surprised. So we are told to do everything in Pakistan, but this was one important thing where they were behind, and now with their help, I'm sure there's going to be, we can make a lot of difference, And as I conclude, I would just say it is so important that that we educate, advocate, and eradicate this ailment, and we can do it with good strategy, with good guidelines, with motivations, and involving with inclusivity and with teamwork. We can help in eradicating or at least regulating it and helping those people who actually need us. Thank you, Yuki.
Thank you so much, Dr. Kaleem. And in closing, I wanted to mention that there's a report, a global report by UNAIDS that just came out. It's entitled Let Communities Lead. And I think many of the points that were raised by the panel and by the speakers before us do resonate with the messages contained in that report. So I do want to invite you to visit the UNAIDS website to see the content of the report. But if you allow me, I would like to end with a quote from our executive director, Winnie Byanyima. Too often, communities are treated by decision makers as problems to be managed instead of being recognized and supported as leaders. Communities are not in the way. They light the way to the end of AIDS. So thank you again. If you could give a round of applause to the panel members, please. Didn't do too bad on the time. Oh, yes, should we have a picture?
Oh, I was.
You can join us.
Sorry to barge in at the last minute. शील्ड डिस्ट्रीब्यूशन है ना सर को 5 मिनट रोकना पड़ेगा ओके बाय स्टार्ट
शील्ड डिस्ट्रीब्यूशन मैं उसमें नीचे बहुत ज़्यादा है लोग.
Your attention, ladies and gentlemen, there will be shields distribution now to recognize the valuable contribution of the stakeholders to the cause of ending AIDS in Pakistan. I'd like to request the Honorable Secretary Health to distribute the shields. Dr. Razia Fatma to receive her shield from the Honorable Secretary. Mr. Julian Harness, the UN Resident Coordinator, if he's around, or if somebody can receive on his behalf. Julian Harness, the UN Resident Coordinator. Kate Somwongri, the Mission Director USAID, to please receive her shield from Sayyid Kaleem Imam, receiving his shield from the Honorable Secretary. Ms. Kate Somwongri, the Mission Director USAID, to please come forward and receive her shield. Dr. Samuel Risk, the Resident Representative of UNDP in Pakistan, to kindly come forward and receive a shield from the Honorable Federal Secretary Health. Dr. Louis Shabane, the UNFPA country rep, to receive his shield from the Honorable Secretary. Dr. Louis Shabane. Mr. Yusuf Filali, the Director and Rep of UNESCO to Pakistan, to receive a shield from the Honorable Secretary. Mr. Asghar Sati, to please come forward and receive his shield from the Honorable Secretary. Asghar Sati. Ms. Yuki Takemoto, the Country Director UN AIDS Pakistan, to receive her shield. Mr. Usman from Daricha, to please come on the stage and receive his shield. Mr. Usman. Dr. Inusa from UNICEF, to please come forward and receive his shield. Dr. Inusa from UNICEF, to please come forward and receive his shield from the Honorable Federal Secretary. Dr. Qasim Abbas, the DNC HIV, to please come forward and receive his shield. Dr. Saima Paracha, to come forward and receive her shield. Ms. Amara Umar, to come forward and receive her shield, please, from the Federal Secretary. Ms. Amara Umar, to receive her shield. Amara Umar, to receive her shield. Mr. Rizwan Nabi Baloch, to please receive his shield. Mr. Rizwan Nabi Baloch, to please come forward and receive his shield. Rizwan. Dr. Andalib, to please come forward and receive her shield. Dr. Andalib. Dr. Andalib.
No, I'm going to call Mazhar Nisar. Thank you so much for all the support. Thank you, Mazhar.
Thank you. Dr. Andalib is here, sir. Thank you, Honorable Secretary. The formal proceedings are now concluded. I'd like to request you to witness the exhibition outside this hall and later on join us for lunch. Thank you. Thank you. सर खैरियत से यहाँ पे यूज़